Welcome to this series, Global Health Series. I'm Vivian Kopsinger-Birchall, your host. Cancer has been around for a while, but there's been increased interest in the past few years to address the increasing disease burden, especially in low and middle income countries. We're seeing an increase in global efforts like the recently launched Global Cancer Moonshot and collaborations such as the Global Health Catalyst and the London Global Cancer Week. So today, it is my honor to host Dr. Susanna Stanway, the founder of the London Global Cancer Week, and Dr. Wilfred Ngwa, the director of the Global Health Catalyst, to talk about their work individually and collaboratively. Welcome to the show. I'd like to invite each of you to please introduce yourselves, starting with Dr. Susan Stanway. Tell us about what you do, and then we'll move on to Dr. Wilfred Ngwa. Thank you.
Thank you very much, Vivian. Thank you, Professor Ngwa. So yeah, my name is Susie Stanway and I'm an oncologist. I'm based in the United Kingdom and I have an interest in global oncology. And that's how we've met. And along with colleagues, we established London Global Cancer Week in 2019, which I think is what we'll talk a little bit more about today.
All right.
Yeah, hi Susie, and hi Vivian. Always nice to do this with you. So I'm Will Ngwa. I'm a professor of global health and radiation oncology and the director of the Global Health Catalyst, an initiative that we started at Harvard and has extended to other institutions involving, focusing on catalyzing collaborations to reduce disparities here in the US and also globally.
Right. So the one thing that is very common between the two of you, the parallels, are the collaborative efforts or the theme of collaboration that is an undertone to the work that you do. So going to you, Dr. Stanway, what inspired the creation of the London Global Cancer Week?
So I think for me, it sort of started several years back, if I maybe take it personally. And it was many decades ago. I was looking after a child who had been brought to the UK for treatment for her cancer from sub-Saharan Africa. And it really profoundly touched me and it got me very interested in the health system in the country that she had come from, and then interested in how this could be improved and cancer care could be improved in different settings around the world. A group of us after that decided to set up a meeting, which we then held annually at the Royal Society of Medicine, around global cancer control and what was happening in the UK, who was collaborating with colleagues around the world in order to improve cancer outcomes. And it was in 2019 that Mark Lodge, who was working at the time, I believe, for INCTR, came along and really saw what this day's meeting could become, and then really pushed for it to become a whole week of meetings with collaborators from around the world. And in parallel, really, there was a network set up, the UK and Ireland Global Cancer Network, that was led by Professor Richard Cowan, and until very recently it is. And this has got multiple subgroups, but really the agenda and what we're trying to do is to bring people together in the UK who are collaborating with colleagues in low and middle income countries and around the world with the same kind of aim and vision, and really to sort of galvanize action to improve outcomes. And it was really sort of stimulated as well off the back of a survey that we did in the two largest comprehensive cancer centres in the UK, the Christie and the Marsden. And we sent out surveys to the thousands of employees to see who were doing collaborative work with colleagues around the world and who would be interested in doing this. And we were really blown away, although clearly not everybody replied. I think we had about 8% of staff replying, but over 500 people did, and around 64% of people wanted to hear more about how they could work with colleagues around the world. And it was just really fascinating. So that stimulated things as well. And so, yeah, London Global Cancer Week started off as a week of sort of 8 meetings, and then the year before last was well over 30 meetings involving many sort of international stakeholders from multidisciplinary settings, from UN agencies to sort of national cancer charities, and more recently through the introduction from David Collingridge at the Lancet Oncology. I'm most grateful to have been introduced to Will from Global Health Catalyst. Because I think, yeah, our agendas and our mission and vision of what we're all trying to do here around the world is really basically very similar. I think it was really interesting because I think at the beginning, the three sort of groups of people that were interested in this were those from diaspora in the UK, many of whom really wanted to give something back and were just grateful for the wonderful education that they'd had and just wanted to improve outcomes back home, or were people who had worked in countries, in low and middle income countries around the world, and were just desperate to do more work in these settings and with colleagues and friends that they'd made. And also people that were just striving for, just to reduce inequalities and disparities around the world, just with that agenda as well. So it's really, it's been great to see the movement in this.
What a background and what a journey. I mean, you've talked about the diaspora being very eager to give back, which is a great segue into Dr. Ngwa. Could you please tell us the history? Your African diaspora, how did the Global Health Catalyst come about? Over to you.
Yeah, absolutely. So like I mentioned in the introduction, the Global Health Catalyst really started, this is kind of seed funded by the Radcliffe Institute at Harvard University. It kind of started because we were looking around as a diaspora, inspired like what, Susie just mentioned, looking at the disparities across the world. And we kind of thought, what a wonderful way if we could collaborate. There's actually an African saying that goes that if you want to go fast, you go by yourself. But if you really want to go further, you have to collaborate. And so we said, okay, looking at the oncology field, cancer is really a pandemic. I mean, it kills more people than, COVID did in most countries, so what can we do if we can collaborate, to treat it with that same urgency that we did with COVID? And so that's how it kind of started. So we got the initial funding, and then after that, we got some funding from the Harvard Medical School institutions. And then more recently, we got funding from the US National Institutes of Health to kind of expand that. And so now we have, programs. We're organizing the Global Health Catalyst Summits at different institutions now. University of Pennsylvania last year, the year before at Johns Hopkins, and, so it's kind of growing to other institutions. And we are also doing that now in low and middle income countries. I just came back from Tanzania with Susie, where we went and launched the initiative for setting up a cancer center of excellence. So, we're already doing things together, inspired by the goal to really make the world a better place against cancer, but reduce disparities as well. So,
I mean, there's so many parallels in your organization, the foundations, and that's why I'm excited later on to come back and say, well, how are the two of you collaborating? I know Dr. Ngwa has hinted on it, that you're already collaborating in Tanzania, but would love to hear more about that. But before we go there, back to you, Dr. Stanway. What are some of the visions of your organization, the vision, achievements, and if you could also tie into how it ties into the economic costs for cancer, and we'll take it from there.
These are big questions. So I think really we wanted London Global Cancer Week to be a platform for everybody and to be easily accessible and essentially free. So sort of free to watch and free to participate. So no money exchanges hands, just so that everybody can get heard. So the big sort of multinational organizations, but also maybe some smaller entities. And I think also we wanted to make sure that it was a platform for the things that we really know make a difference. So yes, we want to talk about the, exciting new drugs and exciting new entities, but we also really want to make sure that there's a focus on what we know makes a difference in this area. So prevention, we know that is going to make a huge difference and is going to be one of the most economically sound things to do. We know, for example, that 80% of the world's billion smokers live in low and middle income countries. We know that cervical cancer can be completely eradicated with the 3 pillars of the WHO eradication strategy. I think we know that we need to have resilient healthcare systems. We know that we need to build capacity. And also we know that it's, like we saw in the HIV pandemic, that this isn't just about science, but many other domains have to come together in this ecosystem. So it's about policymakers, it's about bringing academics, it's about bringing healthcare professionals, it's about bringing finance ministers, it's about advocates, and it's about industry. So this is about everybody, being at the table together. And I think that's one thing we feel very passionately about at London Global Cancer Week. And I think also it's about this equitable platform and making sure that we can all share experiences with with each other. So this year, for example, we're very keen to have a building research infrastructure session whereby we can learn from wonderful initiatives that happen. I think the week before last, the in Mumbai, CS Pramash was running the Credo course, for example, training juniors in India how to write a protocol, a clinical research protocol. And I think that initiatives like that can really be can be shared. So, our vision, we all know that the statistics for global cancer control are really, really alarming. The millions of people that this is now affecting, and the majority of cancer deaths we know are in low and middle income countries. So I think part of this is also making sure that cancer remains prominent in the sustainable development agenda. We know that, if you look at all of the sustainable development goals, cancer can touch upon each of these, and so that's also really important to ensure that we keep it politically high up the agenda. And also with London Global Cancer Week, I think that we also want to make sure that we touch upon the other really important issues happening in the world at the moment. So Earth systems governance, climate change, we've just had the world's hottest year. What's the intersection with cancer? We know that climate change is not going to be good for delivery of cancer care with extreme weather, etc. But we also know that our health systems could probably be greener, and there are things that we could be doing as a cancer community to improve that. So I think it's about that as well. We know that around conflict in cancer, we know that around 2 billion people are now really sadly living in countries affected by conflict. Aortic are about to launch, or have already launched, I think, their special interest group for people affected by cancer in conflict zones in Africa. So we're really keen to hear from that group this year at London Global Cancer Week. I was really pleased to meet Kingsley Ndo at the Global Catalyst, Health Catalyst event in Tanzania, and he's very kindly going to put together a session on cancer care and artificial intelligence. So I think I'm really looking forward to that. And I think also sort of encouraging the coherence in the way that we're all thinking and working together at a global level, so that we're engaging with political leaders together. And we're very fortunate in recent London Global Cancer Weeks that we've had engagement with UK politicians, with ex-European politicians, and politicians from other countries. And I think that that's really important, along with engaging with larger associations, the UN agencies, the Commonwealth, where 2.5 billion people live, and they've already got their network of sort of intergovernmental networks that we can tap into, but also organisations, transnational organisations like G7, G20, and how we engage with them as well, because at the end of the day, this is all going to need financing, and this needs to be cleverly thought about with global interaction. So although it's not just about the UK, and this sort of did, I suppose, start out about what is the UK's contribution to global cancer care and how are we collaborating in the UK with colleagues around the world, but this has now become a global initiative, and we want London Global Cancer Week to showcase all the positive things that are happening around the world and how we can learn in a bi-directional manner from each other. Like Global Health Catalyst, we want to act as a catalyst for change, and we're really excited this year that Eduardo Kazap, who's one of the ex-UICC presidents, is going to be running LATAM Global Cancer Week, which we're really, really excited about. So that's part of our vision.
No, that's excellent, because you've talked about the intersectionality of cancer and other sectors. Well, cancer is healthcare, but other sectors as well. And the other critical thing that you've highlighted is the global actors, the World Health Organization, the UN agencies, the different governments, which is a great segue into my next question, which is going to go to you, Dr. Ngwa. As we're discussing cancer, we have now the Global Cancer Moonshot, which is the US government's way of saying, yes, we were focusing on the moonshot. The focus of the moonshot initially was the United States, but we recognize that we need to spread out and go to other countries as well. So before we get, as Dr. Stanway prepares for how LGCW aligns with the goals of Cancer Moonshot, I'd like to first invite Dr. Ngwa to please explain, what is this Cancer Moonshot? Because I know that the Global Health Catalyst is working very closely with the White House on this.
Yeah, absolutely. So first of all, I'm really excited about, what London Global Cancer Week is doing, extending to Latin America. So Susie, really looking forward to that. That's a really great way to expand. Hopefully you come to Africa. I know you're talking about that too. So, but yeah, the Cancer Moonshot. So the Cancer Moonshot really is was ignited by President Biden, in 2022, with really two clear goals, right? So number one is to reduce death rates from cancer by 50% in 25 years. And then the second goal was really to, meanwhile, improve on the experiences of those who are living and surviving from cancer. So then when we launched the Lancet Oncology Commission for Sub-Saharan Africa, which really shows, devastating increase in cancer across Africa with 1 million deaths per year projected by 2030, we really thought, what a wonderful way to collaborate. We talk about collaboration, right? So we have these Moonshot goals. If we could take these Moonshot goals to low and middle-income countries like in Africa, and they can work together with the US, win-win, like bi-directional, like Susie mentioned, because meanwhile, we have some tools already, that we know we can make, like cervical cancer, she mentioned, to eliminate cervical cancer. We have those tools. So we can quickly reduce that rates by just implementing, right? And we may actually eliminate, we don't only have to reduce it by 50%, we can eliminate that. So we engaged the White House, and the White House has really been, they've unveiled the hashtag Global Cancer Moonshot. And one of the key things there is really, in December 2022, when African presidents came to Washington, President Biden, the First Lady Joe Biden hosted African First Ladies, and they were really strong consensus coming out of that collaboration is really important. That resulted in about $300 million or above in commitment towards extending this to Africa and initiatives. And obviously, that's a great step in the right direction. But right now, the hashtag with Global Cancer Moonshot is really looking at how can we collaborate with the UK? How can we collaborate with Sweden? Just last week, the United States signed an agreement with Sweden, right? So, and things like that. So how can, the world come together and collaborate to develop, a really unified, agenda against cancer, significantly funded, like Susie mentioned, you need to have the resources to really fund, to drive this. And so yeah, really kudos to the White House for, really thinking about this globally, because yes, it's a cancer moonshot, but the idea when we reached out to the White House was just saying, okay, think a little bigger. Don't only think about the US, now think a little bigger, think about global, and I think, they are really committed to doing that. And so during the events this year, we'll continue to advocate, like Susie mentioned, working together now, and I know that the UK has appetite for this and other countries. So we expect that this will just grow. We'll build on that $300 million, and we are looking for billions of dollars to really fund this initiative.
I like what you said, that, asking the more wealthy countries or more privileged countries to think a little broader, and which is a great segue into, over to you, Dr. Stanley. How do the priorities of the London Global Cancer Week align with the goals of the Cancer Moonshot? And while you answer that, Dr. Ngwa will be preparing to talk about what are the areas of collaboration. And but for now, over to you, Dr. Stanley.
So I think probably from what I've already said, our aims are to improve cancer outcomes around the world and play our very, very small part in the great scheme of things in trying to do this. And it's not just about survival, it's also about quality of life and end of life care, and it's really across the continuum, and how can that be improved. And so really making sure during London Global Cancer Week that we give space on the platform to people that want to talk about all of those issues. So from prevention, as I said before, to early detection, to timely treatment, and also it has to be said, to treatment of quality. And I think that that's really important as well, to developing cancer intelligence and making sure that there's adequate funding. So making sure that people in charge of funding are at the table, making sure that we have that everybody around the world has a national cancer control plan that's properly financed, that's accountable, etc. And also strengthening workforces. We know that there's huge gap in healthcare professionals within the cancer workforce, and how can this be addressed? And so I think that through what we've already spoken about, education, convening, networking, sort of allyship, activism, advocacy, mentoring, all of these things that we hope that London Global Cancer Week and I'm sure the work you're doing as well will be a catalyst for, with, you know, the broader aims as you've described it from the Cancer Moonshot, all very aligned with, I think, what we're trying to do as well.
Right. Before I even invite Dr. Nguyen, I'm also looking forward to all these global actors actually centering communication as part of this, because the more I talk to, especially those who are working on the ground, healthcare workers, the biggest burden is communication, or the lack of communication. And I'm just throwing it out there that as you organize your events, please prioritize how do we communicate cancer, and to the low and middle income communities especially. But it's a great segue into collaboration. What are your individual plans, or not personalities, but your organizations? What are your plans for collaboration and areas for collaboration to eliminate cancer as we know it? Of course, as we think about the goals of the Cancer Moonshot and what the Cancer Moonshot could potentially do for our community, for the communities that are struggling the most.
Sure, yeah. So three things. So one, that's why you're here, Vivian. We definitely take into account the media, the communication is really important. In fact, when we did the Lancet Oncology Commission for Sub-Saharan Africa, one of the things we point out is of the 2,000 languages across Africa, many of them don't have a word for cancer. So you have to be able to communicate that to people. You know, if you don't even know what cancer is, you can't even begin to address it, right? The second thing I want to mention is that around collaboration, really kudos to our friend, Dr. David Collingridge, Professor David Collingridge of the Lancet. Susie mentioned that she brought us together initially. That's because he already sees that we can collaborate. But he, you know, has really been visionary in, you know, in shining the light around cancer. And I think, you know, talking about media, you know, that's what the Lancet, you know, is really good at, right? Like, so they communicate, you know, they publish these articles, you know, they even see themselves as a, you know, they are not, I don't think, you know, it's really like really creating that awareness around the issues. And that's what they've done very well with the Lancet Oncology Commission for Sub-Saharan Africa. Was the first major one that really shone the light on cancer in Africa. And then now with that same vision, you know, we now have a USA Cancer Moonshot 2.0 Lancet Oncology Commission that's ongoing. That we really hope is really going to focus on education, which Susie mentioned, capacity building, but really looking at bi-directional. And I think that that's one area where we can collaborate, you know, really focusing on workforce development. That is so important. And it's areas where there's a huge demand. You know, a lot of medical students, a lot of people from across disciplines, engineers, science, people who want to participate globally, and being able to mobilize that workforce together and empower them to collaborate with lower middle-income countries and across the Atlantic with the UK, with Susie, you know, I mean, that is just so powerful, you know. So that's one area. The second area, I think, is just the advocacy and awareness. And that's where partnership with you, Vivian, is also important from the media, you know, because politicians listen to the media, right? You know, Susie and I can talk all this all day long, you know, if you don't convert that to language that the politicians and policymakers understand, you know, or the society, we're just wasting our time. I mean, we will not go further. We can go so far, but we're limited, you know. So that's really important. And I think that's, you know, we're very excited. So we have the Global Health Catalyst Summit coming up in June 7th to 9th in Washington, D.C., right between the White House and Congress. We're going to have a lot of policymakers involved. But having Susie and London Global Cancer Week there is going to be one area where we're really going to collaborate. Coming out of that, already some concrete actions in advocating for, you know, this Global Cancer Fund, momentum for that, you know, but just collaborations around these areas, workforce development, more decent clinical trials, implementation research. I mean, there's just a lot of opportunities for win-win. Oh, and I have to mention AI, obviously. It's one of the big areas. Susie mentioned that because it can really help leapfrog, you know, it's empowering health professionals, oncologists, patients, you know, so many people. So that's an area we really want to invest in the next summit as well. So, you know, I mean, those are two easy areas to talk about, you know, but I think, you know, those are also very powerful areas that can really make a big impact.
Well, thank you, Dr. Nguyen. Dr. Stanway, your take.
I mean, no, that was a brilliant summary. I haven't got a huge amount to add. I think, yes, I mean, having space on your platform will be fabulous. I'm really looking forward to the meeting in June. I also think that there's huge energy and enthusiasm to make things better amongst the younger generation. And that's something which I feel particularly excited about. And I think sort of encouraging peer-to-peer support around the world, again, in a bi-directional manner, I think I've just been seeing really exciting and really interesting and wonderful things coming out of that recently. So yeah, really looking forward to collaborating with Global Health Catalyst in the future.
Well, this has been a very, very exciting conversation. There's a lot of momentum going on, which is giving me so many positive vibes and energy that we're actually growing a family that is fighting cancer and cancer disparities globally. With that, I'd like to ask you if you have one word for our viewers before we close this meeting. I'm sure we'll have many more conversations, but just to keep this within the time that we wanted, I'll start with Dr. Stanway. Any message for our viewers?
I think really just to say that I think that by all coming together and uniting and making our voices louder, so that we are heard and things change, I think this is where the power of making a difference and moving the dial on this and improving global cancer outcomes. Thank you very much for inviting me today.
Dr. Kangwa?
Yeah, it's really wonderful and an honor to have this interview with Susie, and then thank you, Vivian, for, hosting this. It's really important. I hope you can host us again in June, during the summit live from there to kind of tell you some more concrete things coming out of this. The only one word I'll have for viewers is, definitely June 7th to 9th. You can check out the website, globalhealthcatalyst.org. You can see, the upcoming summits. Everyone can participate. The unique thing about global health is that it's very cross-disciplinary. Everybody has a big role. So, anybody can contribute. So if you know somebody who's been affected by cancer or anything like that, please get off your seat and definitely participate, get engaged. It's a really critical time in the world right now. We need to address this pandemic, so
Absolutely.
everybody can participate. So.
Absolutely. I'd like to say thank you to the both of you for taking the time to speak with us, to be joining us for this interview. And to our viewers, I hope that this has interested you enough to actually look out for the Global Health Catalyst Summit details and join the summit. We would prefer in person, but if you can't make it, there will be an online version. But for now, thank you for watching this Healthcare Blind Spots series. Till next time.